أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قد أفلح المؤمنون الذين هم في صلاتهم خاشعون والذين هم عن اللغو معرضون والذين هم للزكاة فاعلون والذين هم لفروجهم حافظون إلا على أزواجهم أو ما ملكت أيمانهم فإنهم غير ملومين فمن ابتغى وراء ذلك فأولئك هم العادون والذين هم لأماناتهم وعهدهم راعون والذين هم على صلواتهم يحافظون أولئك هم الوارثون صدق الله العظيم.
Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen, and all the worthy guests. We are living in a very strange and difficult time. All the horrific image and the worst nightmare of pandemic we had is now on a reality. We are facing immense challenges in every aspect of our lives, and arranging a conference of full of people was a pipe dream. However, it is unfortunate for young surgeons and doctors to miss those learning opportunities which we all had and improve knowledge and skills. Dr. Anwar pointed out the need of international conference, as time has arrived as per APSP tradition to have an international conference after every 2 years. It was a huge task, not only to arrange the international conference, but also in just 1 month time the whole team of NICH was convinced that due to COVID-19, very little hands and educational activities are being performed in training institutes. Conferences like this are healthy for not only growth of young trainees, but for the faculty as well. I am extremely proud of NICH team who made this dream possible. Their tireless effort and unbelievable motivation made all of us proud today. I can proudly say that these young trainees are our hope for the future, and their remarkable work of ethic taught us too many lessons. Yes, there is a light at the end of the tunnel. Despite all the enthusiasm and motivation required to execute this international conference, our team is blessed with the mentorship of Dr. Jamsheda, whose contribution in planning and execution of this conference can't be expressed in few words. Being a chairman of organizing committee, nothing made me happier to see the overwhelming response we received in terms of registration and abstract submission. This shows that our fraternity is not sitting in idle, but they are looking for opportunities to showcase their enhanced skill and commitment to this noble profession. I hope the tradition of conference will continue, and no barrier will ever be able to stop the tradition of knowledge sharing. I must thank you all for your glorious presence. Thank you.
Dr. Zeba Atta, please come on stage. Professor Ghulam Nabi as President, APSP. Professor Inayatur Rahman as outgoing President. Dr. Jamal Raza, Director NICH. So let's move on to the next segment. And here we are going to remember our senior colleagues who are no more with us. Your sudden death has touched our lives and hearts. The way you have inspired us has touched us even more. I request Dr. Sufia to share her thoughts for Professor Dr. Nizamul Hassan, who is no more with us. Dr. Sufia.
Assalamu alaikum. I was telling Tayyaba that we should just keep this picture on screen so that we can see him laughing, and he was a wonderful person. And I'm thanking all the organizing committee for asking me to talk about my mentor, with whom I worked from the first day I walked into NICH, and that was way back in 1985. I remained affiliated with him in different capacities till the time of his death. He not only nurtured our surgical know-how, but how he became to become a better person, for he was a fine human being. And we are not only indebted to him for establishing a very well technically sound pediatric surgical department, providing us with facilities which are present in the best centers of the world, but also for starting this very association of pediatric surgeons as well as the association of pediatricians. It was his vision that we would be on one platform and get recognition on an international scale. He sent his residents to training not only to different centers in Pakistan and abroad to learn their approach to common pediatric surgical problems, was also to broaden our outlook on life so that we could bring a positive change to the department. He was a man of good principles and always followed SOPs. I remember when a remanded neonate was left with us for treatment, he made sure that the proper adoption center would take him and then established him in a proper foster home, despite demand from many people in the hospital that they would be given his charge for adoption. Even on a busy, rigorous night of February probably, a child was brought with multiple injuries and he succumbed to them shortly after arrival. He did not let us hand over the body to the attendants till the medical legal officer would come to JPMC and look into the issues of child abuse. Maybe Zeba remembers this case, I think we were there together. Dr. Nizam was also into social work right from the beginning, and he was running an NGO by the name of Child Aid Association that provides medicine to the poor, and he used to provide rations to many families, and all used to be holed up in a small tiny room of our OPD. Not only that, any request from the Department of Paediatric Surgery for any costly equipment or medicine, he would go out of his way to find donors and provide the department with those things. By his entire effort, he established a separate cancer ward in the hospital where cytogenetics and a pharmacy providing parenteral nutrition was made available to the poor children of NICH. This used to be a very expensive test, as well as the nutrition which was available only at Aga Khan and was very expensive for the poor children. He was a man who used to love to laugh and make light jokes with the staff. He would love to tease them, but at the same time, he really looked after them and their problems. We in NICH were two departments, but he kept us united with weekend rounds, picnics, dinners, and other outings. It was routine to celebrate the second day of Eid with him, which gradually took place after his retirement. He was extremely proud of the achievements of our present-day pediatric surgeons, their knowledge, their skills, and having made a name for themselves, but also for the country. And I'm sure that he will be at peace today, that his legacy is in good hands. Thank you.
I will call Dr. Jamal Raza to please come up the stage and take his seat. Dr. Jamal Raza is director in NICH and he's also a pediatric endocrinologist.
वहाँ बिल्कुल एसटी के पास तो पूरी कुछ भी नहीं आएगा।
मकदूर हूँ तो हाथ से पूछूं कि ए रहीम तूने वो गंज हाय गिरा माया क्या किए। हमने डॉक्टर फरहत से गुजारिश की थी कि डॉक्टर दौलत खान के बारे में अपनी यादों को हमसे बांटने के लिए, तो उन्होंने हमारे पास, क्योंकि वो यहाँ पर है नहीं, सऊदी अरेबिया में होते हैं, तो उन्होंने हमें एक वीडियो मैसेज रिकॉर्ड करके वो हमें भेजा है। आई थिंक सबसे पहले हम आपको वो वीडियो मैसेज दिखाते हैं।
दौलत खान से हमारा साथ 25 साल से ज़्यादा अरसे का। वो एक इंतहाई सीधा, खरा और पुरखलूस इंसान था, बहुत मेहनती और धुन का पक्का था। मुझे याद नहीं कभी उसने किसी का दिल दुखाया। उसके इंतकाल से 1 माह पहले मेरी उससे बात हुई तो हस्बे मामून दौलत खान के पास अपने उसातिज़ा और साथियों के लिए सिर्फ दुआएं ही दुआएं थी। उसकी तबीयत पूछने पे उसने बताया कि बहुत ज़्यादा बात करने से उसका सांस सूखने लगता है और उसको ऑक्सीजन की ज़रूरत पड़ जाती है। मगर उसकी इन बातों से ये कभी अंदाज़ा नहीं हुआ तो इतनी जल्दी मैं आखिरी सफ़र पे रवाना हो गया। खान की सोच बड़ी सुलझी हुई थी। इसका अंदाज़ा ही नहीं लगाएं कि एक दफ़ा मैं और दौलत खान सदर कराची में थे कि एक 50-55 साल का इंसान कंधे के ऊपर जूते पॉलिश करने का सामान रखे नज़दीक आया कि जूते पॉलिश करवा लो। मैंने उसको कुछ पैसे देने चाहे तो दौलत खान ने टोक दिया कि आज बगैर किसी काम के तुम उसको पैसे दोगे तो कल ये अपना ये काम छोड़ के पैसे मांगने पर लग जाएगा और उसकी इज्जत नफ्स खत्म हो जाएगी। भला का मेहमान नवाज था। जब भी हम क्वेटा गए तो वो सब काम काज छोड़ के अपने दोस्तों की खिदमत में लग गया। उसकी हिस्से मजाक भी बहुत खूब थी। एक दफ़ा मैं जमशेद और दौलत खान खाने पे गए, मुझे याद है हमने पिज़्ज़ा ऑर्डर किया जो शायद उसको बहुत ज़्यादा पसंद न था। जब हम बाहर निकले तो कहने लगा यार ये भी कोई खाना था? एक रोटी 2-3 रोटियाँ उसके ऊपर 3-4 सब्जियों के टुकड़े रख दिए और पैसे भी इतने ज़्यादा ले दिए। यार तुम लोग क्वेटा आओ कभी हम तुम खिलाएगा और बताएगा कि सब्जी क्या होता है, दम पुख्त क्या होता है, तिक्के कबाब क्या होते हैं। इस तरह से उसने अपनी नापसंदीदगी का इजहार भी कर दिया और दूसरे का दिल भी नहीं दुखाया। दौलत खान अपनी ऐसी ही कई खूबियों की वजह से हमें हमेशा याद रहेगा। अल्लाह ताला से दुआ है कि उसकी बख्शिश करे और उसके दर्जात को बुलंद फरमाए। आमीन।
Professor of Pediatric Surgery, Professor Sami Shihada. He's from University of Alexandria, Egypt. He's also president of Egyptian Association of Pediatric Surgeons, and presently he's president of WOFACS, World Federation of Association of Pediatric Surgeons. He's live with us, and he's going to give us some message. Okay. It will take some time. So, can we go ahead? Can we go? Okay. We will wait for just an hour before because we were not sure what would be the time of starting up of our inauguration. So, Haris is trying to get connected with him. So in the meantime, let's move forward. And I would like to invite Dr. Naima to introduce our online.
Assalamu alaikum, ladies and gentlemen. This is Naima Zameer. Today, on the occasion of inauguration of 29th International and First Hybrid APSP Conference, I feel proud to present you the great pioneer pediatric surgeon of Pakistan through their text or video messages. Although it cannot be an alternative for their physical presence, but even their words are honor for us. The first message we are sharing with you here is from Honorable Professor Abdul Hamid. On his behalf, Professor Sajid Hamid sent this message to us. Professor Abdul Hamid is the pioneer of pediatric surgery in the province of Punjab. He did his graduation from Dow Medical College in 1957. He went to Dublin in 1959. He passed his FRCS in 1965 from Dublin. With his splendid effort, he could establish the first unit of pediatric surgery in Punjab at National Medical College, Multan, and the second one followed by others like Mayo Hospital, Lahore. From where he was retired in 1993 as a pediatric surgery professor. College of Surgeons and Physician Surgeon of Pakistan in 1993 awarded him with the LCPS in pediatric surgery in recognition of his services. His services during the war of 1971 and earthquake of 2005 are highly appreciable. For his honorary medical services in the military, he was honored with the designation of Lieutenant Colonel. These days, he is taking it easy, playing with golf in the morning and catching up with his reading in the evening. The message we are sharing with you from Professor Abdul Hamid. Faris, can you play that? Okay. It's a message from him. On the occasion of our annual conference, I would like to share some observations that I have made during my life. Our patient is the most important thing for all of us. We should strive to serve him to the best of our ability. One should try to achieve mental peace. One can do this by following our religion and law of the country. I realize that having too much property and wealth is a curse. I wish you have a successful conference in this constrained time. All the best. The next we are having a message from Professor Naeem Khan. For this I request Professor Muhammad Arshad to come on the dais and read his message for him. Professor Naeem Khan is a tremendous motivating personality for all of us. Naeem Saab did his graduation in 1963. He was trained at Great Ormond Street Hospital. Later on returning to Pakistan, he established the first pediatric surgery center in Islamabad. He received Sitara-e-Imtiaz, one of the highest civil awards of Pakistan, for successfully separating conjoined twins in 1992. He was an ex-president of APSP. He is the author of books like Pediatric Surgery Problems, Ectopia with Ikea, and Atlas of Pediatric Surgery. Even today, he's worked very hard, he's keen to learn, and he has a great bonding with his patient. And with that is the inspiration for all of us. So please.
Thank you very much, Dr. Jamshed, for asking me to read a message from Professor Naeem Khan. I have a long association with him, and I visited PIMS as an elective fellow in 1998, and my bonding with him has been very strong. So when Jamshed asked me to talk Dr. Naeem's message, I called him and I said that, sir, I have been given this duty to read this. He said, but I have written a lot of things which you may not like. But I said that it's a pleasure to read. So I read Professor Naeem Khan's message. It is wonderful to witness a rapid academic flurry of activities and progress in pediatric surgery in every corner of Pakistan. This is mainly because of easy access to modern communications, which we now have. This has resulted in instant communication of professional and academic ideas. Arranging conferences like workshops, demonstration of practical procedures, like every other specialty, present day teaching and training of young pediatric surgeons has completely changed. Some may argue that there is no need for didactic classroom lectures. There are significant advantages in training and learning. However, we have to seriously ponder how these developments in information technology have been translated for the benefit of patients, especially in a third world country like ours, where a teeming large population of children go unattended and untreated because of lack of resources and access to a proper pediatric surgical facility for safe management. I will exemplify two extreme scenarios. We often teach and advise a child born with a pneumonia hernia to get him operated on immediately in the neonatal period. In some very big pediatric surgical units, many children with esophageal atresia wait for surgeries. To enhance our status, we hold a conference to discuss robotic, minimal invasive surgeries and invite authorities from Dubai and other countries to demonstrate state-of-the-art procedures. I am a very keen learner and have learned more from my failures and long-term follow-ups. But in the recent times, I have not seen anyone posting any complications either of open and especially of minimal invasive surgeries. confront us in our hospital for the safety of patients and the hospital staff. I feel we must keep our priorities firmly on the ground to provide a safe service to all of our children equitably. Only then the sun will surely shine on our future desires and ambitions. Till that happens, we must make plans with humility and wisdom for the future. Thank you very much.
Thank you, Professor Rishi. Now we are moving toward Professor Farad Balsam. Professor Farad Balsam is an eminent pediatric surgeon trained in USA. On returning to Pakistan in 1985, she was appointed as the founding chairman of Department of Surgery and the first associate dean of postgraduate medical education in Al Khan University, Karachi. A very reputable and structured surgical residency program was established under her leadership. Professor Balsam is also founding chairman of Center of Biomedical Ethics and Culture in SIUT and has had a long academic career. She is currently a fellow of Institute of Practical Ethics and visiting professor at the Center of Humanism in Medicine at University of Virginia, USA. She has published extensively in her areas of interest. Dr. Balsam has an energetic personality and a role model for all of us. Let's see what message she has given on this occasion of 29th APSP conference.
And dear colleagues, Assalamu alaikum. I would like to thank the scientific committee members for giving me this opportunity to send this video message to all of you. My apologies, I would have preferred to have been with you in person. Unfortunately, today is the day when we are holding examinations for our own students. These are students in our programs in the Center of Biomedical Ethics and Culture in SIUT. And because of that, I am unable to be with you. My apologies for that. It's my pleasure to just say a few words of welcome to all of you. And this is welcome to the 29th International Conference of the Association of Paediatric Surgeons of Pakistan. There is nothing more appropriate that the conference is being held in the National Institute of Children's Health in Karachi. There is no other place, I believe, in our country that has done more for the cause of pediatric surgeons. In fact, NICH has essentially served as the fountainhead for the education and training of pediatric surgeons who are now distributed in all the provinces and major cities of this country. My own association with APSP essentially began in the late 1980s when I returned to take up the position of chair of the Department of Surgery in the Al Khan University. One of my earliest struggles, and that's something that pediatric surgeons who are sitting here would relate to, was to convince people that pediatric surgery is a special field, it's a specific field, and to convince adult surgeons that, quote, children are not small adults. Taking care of them is a completely different thing. And in fact, I've always considered in the time that I have spent after coming back to Pakistan among the various responsibilities that I have taken up, I think the most fulfilling for me professionally has been beginning the pediatric surgery training program in AKU and having it recognized by CPSP. So, सबसे ज़्यादा मुझे जो फ़ख्र है वो ये है कि the small role that I have played in helping pediatric surgery grow in Pakistan. So essentially, taking care of children, all of you know, is a very, very special field. It is a field that gives you the opportunity to take care of a child, a newborn, for example. And if what we do for the child, surgery that we perform, if it is successful, we have this wonderful years to follow this child grow into an adult. If you compare this, when you do a surgery on adult patients, I mean, you give them hopefully a few years of good life. But when you operate on a child, you have the potential to really helping to give that child years of productive life. And there is no pleasure more than an adult walking into your office and saying, "You operated on me when I was 1 year old." So in pediatric surgery in Pakistan, I think we have come a long way since the time in the 80s when I had first come back. And today I miss Professor Nizamul Hassan. He was among the first to draw me into this association in those days. So we have come a long way in pediatric surgery. However, there is still a long way to go for us. My understanding is that pediatric surgery right now, if I'm correct, in the association there are perhaps 200 pediatric surgeons who are members right now, including life members like myself. And then several of our pediatric surgeons who train here have left for other countries. So, सुल्तानपुरी साहब का एक बड़ा अच्छा कपलेट है जो मैं आपको सुना देती हूँ। मेरे हिसाब से अगर हम देखते हैं कि पीडियाट्रिक सर्जरी जब शुरू हुई थी in the late last century और अब वो जहाँ तक पहुँची है तो वो सुल्तानपुरी साहब ने कहा है, मैं अकेले ही चला था जानिबे मंजिल मगर लोग साथ आते गए और कारवां बनता गया. So I think this process has begun and this association is a primary proof of that. लेकिन ये कारवां जो है ये अभी पूरा नहीं हुआ है. And I hope that this thing will continue. Your association has a great program. I've looked at the schedule. The conference today has, as I understand, not just talks but also panel discussions, which is the best way to exchange views, and our younger colleagues and our trainees benefit from that. I also see that you have a lot of workshops planned, and I think the next 2 days are going to be great days for everybody. And all I can do is wish you the very best for a very successful conference. And once again, Maazrat hai, I would have preferred कि मैं आपके साथ होती, लेकिन perhaps at the next meeting, next conference that you have, I will be able to do that. So thank you very much and have a successful meeting.
Next in the line is addressed by the chief guest, who is Dr. Abdul Aziz. But he's not here. Since he's not here, so his video message is with us. But before that video message, I would like to call upon Dr. Naima Rasool to tell you about his biography. Professor Dr. Abdul Aziz, an eminent pediatric surgeon. He was one of the pioneers of pediatric surgery in Pakistan. He did his graduation from Dow Medical College in 1964. He did his FCPS in 1974 and fellowship in pediatric surgery from University of Melbourne, Australia in subsequent year. He served in NICH from 1980 to 2002 and retired as professor and head of Department of Pediatric Surgery. He has also served as secretary and vice president and dean of postgraduate studies in College of Physicians and Surgeons, Pakistan. He started primary surgical skills workshop through CPSP nationwide with Dr. Jamshed and late Dr. Asadullah Khan. He has trained many pediatric surgeons who are serving right now at national and international venues, following his brilliant legacy. May Almighty preserve him in good health. Amen.
APSP. It is appreciable that you people have arranged the conference in such a problematic scenario of the COVID-19, where life has become restricted. And I myself is not attending this conference, for which I am very, very sorry. These educational conferences are vital for the progress of the pediatric surgery fraternity of Pakistan, where the seniors can share their experience, new techniques and advancement can be discussed. Through these, juniors can learn and get a platform to present and express themselves, which is an essential part of their academic grooming. I am happy that you people have continued to arrange this year as well without a break. I appreciate all those who have traveled to Karachi from all over the country to make it a successful event during this COVID-19 era. But my sincere advice to all is please follow SOPs to save yourself and others. My best wishes are with you. Assalamu alaikum.
By our guest of honor, who is Dr. Zeba Attar, but before she speaks out, Dr. Muhammad Aqil Sumru is going to say a few words about her.
I have seen these two ladies in my pediatric surgery infancy, and I would proudly say that probably your fraternity is the one who has produced first resident through a program, which was a lady in the time when ladies were rarely seen in surgical fields. Dr. Zeba Attar, an eminent consultant pediatric surgeon. She did her MBBS in 1982 from Dow Medical College, Karachi. She worked as Registrar Pediatric Surgeon at National Institute of Child Health, Karachi from 1984 to 1988 with legendary Professor Nizamul Hassan, and she is carrying the badge of honor to be the first MS candidate in pediatric surgery. Currently, she is working as consultant pediatric surgeon in Fatma Jinnah Dental College. She has written, published, and presented various research papers in clinical meetings across the country. She also has vast experience of working as pediatric surgeon in various hospitals of the city. Let us clap for her. Dr. Zeba Attar.
Karachi.
Mic is not working.
इन्होंने खामा में तारीफों के पुल बांध दिए, मैं इस काबिल नहीं हूँ. Yes, I graduated from Dow Medical College in '82, and at that time as well as now, there were federal seats. I was lucky to be in the first 20 in my final year. So I applied for a federal seat, and I got admission as a house job. I got my house job, did my house job in JPLC. छोटी सी मज़ेदार स्टोरी ये है कि my father was an anesthetist. उन्होंने वसीयत की कि कभी एनेस्थेटिस्ट नहीं बनना, और my mother was a gynecologist. उन्होंने वसीयत की कभी gynecologist नहीं बनना. और मेरे फादर, I saw my father struggle with, general surgeons, and he said those general surgeons. So I said मुझे तो surgery का शौक है, अब मैं क्या करूँ? So when I did my house job with Dr. Ashfaq here and Surgeon Hamid here, then I continued for a year with Dr. Asad and Dr. Abdul Aziz in surgical 3. And then I approached Dr. Nizam and I said, ये दो वसीयतें मुझे करनी है, लेकिन pediatric surgery किसी ने नहीं की, मुझे pediatric surgery करनी है, and I don't think there's anything against it, because there's no pediatric surgeon trained in Pakistan. At the time, everybody came with FRCS from England and then, got trained in pediatric surgery. So I just said I want to do this. So he said, okay, let me see how you fare. I got, at the same time, I applied in Sindh Public Service Commission and I got a job in civil hospital. Dr. Nizam said, अगर तुम्हें pediatric surgeon बनना है तो तुम उसको अपनी commission job को जो है वो resign करो. He made me resign that, and then I continued with him. I went to Japan as well for a sort of scholarship in higher technical training during my residency in Japan, and I did that. मजे की बात थी कि I was always a postgraduate. I was never commissioned, so I was working without pay. And since I was working without pay, I wasn't following the rota. And since I wasn't following the rota, then I was doing 24/7. And Dr. Nizam used to call me anytime and ask about any patient, and I had to be, really updated about these. So, he had a knack of asking. Khuda, matlab, he had God gifted thing that he had a knack of asking the thing which I overlooked. And फिर बाद में जो डांट पड़ती थी जो वो होता रहा. बहरहाल जैसे मैं अपने आप को डॉक्टर निज़ाम का फर्स्ट सर्जिकल बॉर्न चाइल्ड कहती हूँ, तो probably that was it. And इसका सिलसिला ये था कि at that time I wanted to do fellowship, and I approached the College of Physicians and Surgeons, and Dr. Fazlul, most of you must be knowing him, marhoom, a great man, said अभी तो बेटा अभी नहीं शुरू हो रहा, शायद जल्दी शुरू हो. But I said I'm already a postgraduate, I have to enroll in some program. Said okay, तुम डॉक्टर निज़ाम अगर चाहते तुम MS करो, लेकिन मैं तुम्हारा एग्जामिनर बनूंगा और मैं FCPS के उसके ऊपर करूंगा. So he took my exam, he took just like basics भी लिया और हर चीज़ मेरे external examiner बनकर आए, and he did it on that thing, and he said कि चलो ठीक है. फिर उसके बाद अल्लाह का शुक्र है, I did my post graduation, and since I wasn't employed over there, I moved on to ATU. So, but I always, this was Dow के बाद भी मेरा alumni था, मेरा parent institution था. I never, it was like attached to an ICH with an umbilical cord. I never lost in touch with it. But people like Sufia and Jamshed have always been with me. And Dr. Nizam हमेशा phone करके पूछा करते थे क्या हो रहा है भाई, क्या हो रहा है. So it kept me on my toes always. So alhamdulillah, अल्लाह का बहुत शुक्र है, I have reached to this stage, और thanks to all of you.
Dr. Harun Pasha. About Harun Pasha, Dr. Harun Pasha, Dr. Muhammad Ali is going to say a few words, and it will be followed by a video message by him because he is not here in person.
Thank you, Taiba, for giving me this opportunity to say a few words about Professor Harun Pasha. He is the first FCPS in pediatric surgery, and he did his residency at Eastern Medical College, Multan. Later he was promoted over the years and became professor in the same hospital. He remained instrumental in teaching, training, and residency programs of FCPS. Later on he served as principal of Qaeda Medical College, and where he made a number of transformational changes in conventional training of the undergraduates. He is not coming to this conference unluckily because of his reasons, but he has sent his video message from Multan.
Dear friends, first of all, my apologies for not attending the conference in person. I was the first candidate in 1986 to get myself enrolled into the newly recognized specialty, pediatric surgery. At that time, the requirement were 1 year general surgery training with resume of 30 cases of general surgery done during this time, and then 3 years training in pediatric surgery and 3 months training in pediatric medicine. The training was not structured, however, I had to write a dissertation in the subject of pediatric surgery, which was on anorectal malformation. Now after that, the trends changed, and then the objective system and structured training started in pediatric surgery as well, and in all the examinations. Previously, very few people used to get through these examinations, but now the number is encouraging and great. Previously, they used to test the pure knowledge, not the core knowledge. So, anyway, that was also a good way of evaluating the candidates. But I think the qualified candidates of pediatric surgery, they should focus on the diseases which are newborn surgical diseases, and they should not run after those things which are being done by the general surgeons. So the congenital abnormalities like anorectal malformation, Hirschsprung disease, atresias, gastroschisis, which is mandatory to appear in part 1. So it was also 5 years at that time. So when I appeared in my first examination in part 2, there were 6 examiners, and all of them were very senior pediatric surgeons. They were Professor Amanullah, the founder of pediatric surgery in Pakistan, late Professor Naseem Raza, late Professor Sagir Ahmed, and late Professor Mohsen Azhar Ali. Along with these 4 pediatric surgeons, there were 2 examiners from general surgery, and I still remember they were Professor Ghulam Mustafa and Professor Shami. Both of them are no more. And then there was a member of Pakistan Medical and Dental Council. He happened to be a general surgeon. I forget his name. He was from Army Medical Corps. He was brigadier. So the exam was very interesting. So there was no time limit, और तमाम लोग इकट्ठे होके सवालात पूछने लग जाते थे. तो मैंने उनसे कहा कि आप अकेले अगर मुझसे सवाल करें, तो उन्होंने कहा कि प्रॉब्लम ये है कि यू आर द ओनली कैंडिडेट एंड वी आर 6 or 7 people अराउंड. तो हमारे लिए या तो कॉलेज को डमी कैंडिडेट रखने चाहिए या हमें भी अपना आप वो पूरा करना है. So all of them were very knowledgeable persons, and same thing happened on the table viva. All those 7 examiners, they sat there, and I had to answer the general surgery questions like surgery, CA prostate, surgery of gallbladder, apart from the pediatric surgery cases as well. So when I got thought through, I was there 8 to 9 years. I was promoted as professor, of course, after writing the desired research papers. So I think I am one of the beneficiaries of this noble specialty, and I pray for the newcomers that they should also flourish. मैं बहुत मुतमईन हूँ इस स्पेशलिटी से, इसमें मुझे काम करने का मौका मिला और मैंने खुल के स्टार्ट किया। रिटायर हुए मुझे 4 साल हो गए हैं, अभी तक मैं काम कर रहा हूँ। तो मैं आप लोगों से भी दरख्वास्त करूँगा कि आप अपनी स्पेशलिटी तक स्टिक रहें, क्योंकि अगर आप अपनी स्पेशलिटी तक स्टिक रहेंगे तो फिर ही आप लोगों को बेनिफिट पहुंचा सकते हैं और आपका और दूसरे लोगों का फर्क वो साफ वाज़ेह हो सकता है। दूसरी बात यह है कि पहले यूनिट, जो सबसे पहला यूनिट कराची में बना, फिर दूसरा यूनिट पाकिस्तान में मुल्तान में बना, फिर तीसरा लाहौर में बना और फिर ये यूनिट एक्सटेंड होते गए, इस्लामाबाद में बना, पेशावर में बना। इन तमाम यूनिट्स में ये खासियत थी कि हेड टू टो पीडियाट्रिक सर्जरी होती थी, यानी कि उसमें न्यूरो सर्जरी भी थी, उसमें ऑर्थोपेडिक सर्जरी भी थी, यूरोलॉजी भी थी, प्लास्टिक सर्जरी भी थी और ऑफ कोर्स पीडियाट्रिक जनरल सर्जरी वाज आल्सो देयर। और ये तमाम लोग मैंने महसूस किया है कि इन जगहों पे काम करने वाले चिल्ड्रन हॉस्पिटल्स के मुकाबले में वो जल्द पास हुए, क्योंकि चिल्ड्रन हॉस्पिटल में स्पेशलिटीज़ के लिए इनको रोटेशन पर भेजा जाता था और रोटेशन के अंदर जो आजकल जो लोग हैं वो इसको एक हनीमून पीरियड गर्दाते हैं और 3 महीने और 4 महीने वो अपनी डेजिटेशन लिखने में, अपने रिसर्च पेपर्स लिखने में या अपनी शादी करवाने में या और अपने जो रुके हुए काम हैं उनके सोशल और घरेलू उनको गुजारने में गुजारते हैं। तो मैं समझता हूँ कि या तो इसकी बाकायदा तौर पे इनकी स्ट्रिक्टली मॉनिटर ट्रेनिंग होनी चाहिए और या फिर जनरल सर्जरी के साथ साथ इनको स्पेशलिटी ओरिएंटेड केसेस भी करने की इजाज़त दी जाए। मैं आप तमाम लोगों का शुक्रिया अदा करता हूँ और इस कॉन्फ्रेंस की सक्सेस के लिए मैं दुआ करता हूँ। शुक्रिया।
बिस्मिल्लाहिर्रहमानिर्रहीम। Honorable Chief Guest, Professor Abdul Aziz, guests of honors, Professor Harun Pasha and Dr. Zeba Atar, Honorable Director NICH and Patron of Conference, Professor Sayyid Jamal, Chairman Organizing Committee, Professor Nasir, Professor Jamshed, all the members of Organizing Committee, new President of APSP, Dr. Ghulam Nabi, my highly esteemed faculty, residents, ladies and gentlemen. I really feel honored and privileged that today I completed my tenure as President of APSP. I express my heartfelt thanks to all the members of APSP for being given this opportunity to serve as President of APSP. I am thankful to General Secretary Dr. Ayub and all the executive members for their support and valuable input in running the affairs of the association. In our time, we tried our best to strengthen the association, make it financially independent, promote the culture of research and academic activities, and make APSP a vibrant and internationally renowned association. I would like to mention some of the targets which we achieved during our tenure. Number one is the launching of the Journal of Association by the name of Journal of Adolescents and Paediatric Surgery. And for that, I am grateful to Professor Salim, Professor Nabila, Dr. Bilal, and their whole team for their efforts to accomplish this goal. And we have the publication of the first issue of the Journal of Adolescents and Pediatric Surgery. Now, my request will be, we, the association, gave a donation of 5 lakhs for this journal, and now when it is started, we should contribute our research, our articles, so that it is recognized from PMDC, HEC, and I think we all should subscribe that we should stop this journal again due to financial problems. We have a team, a very committed team, a very dedicated team, and we should continue with this. Second achievement is the development of website of APSP. Professor Iftikhar, he was kind enough to take this responsibility, and he materialized it. Our website is now functional, and you can upload your educational activities, educational videos on our website. The third target was establishment of Central Secretariat of APSP with a data bank and hiring of permanent secretary for central office. Again, I am thankful to the team of Children's Hospital Lahore. And also I am thankful to Professor Mahmood Shaukat. May Allah give him complete and quick recovery. He is improving, inshallah. So he offered his office for this secretariat, and again Professor Nabila was made in charge of that office, and now this office is established. We have got a permanent secretary, Mr. Nasser Shamshan, who has already worked and he knows the things. So now it is there, and the other part of this, we decided that we will develop our data bank at the Central Secretariat. And that data bank should include all the names of all the members of APSP, and we should register our residents as associate members, and their registration fee is 1,000. And there we should also have a data about our induction of trainees in pediatric surgery, the rate of passing of our trainees, and in addition to this, we should have a data of our patients also from all the units, so that we should know that the gap between the resources and the workload and the patient burden, that is shrinking, or that is increasing, and this will be a very important data for anybody who wants what is the status of the pediatric surgery at this time. So I think we should initiate this. There is no problem now in this. We all do our morbidity and mortality meetings, audit, and it is monthly, somewhere it is 2 monthly, and then we should send the data to the central office. So, and we should also have the data of the pediatric surgery members. So this will help us in achieving our goals of promoting the pediatric surgery. Now, our next target was our registration of APSP as professional body with SEC, Security Exchange Commission of Pakistan. This process was initiated. We completed all their requirements. Again, Professor Nabila, Professor Salim, and Nasser, they were actually pursuing this, but there were some hindrances, legal. The final message which Nasser gave me, that they said that you have to change the name of the association. Now this is not possible, but I hope that Professor Salim, he will use his wisdom and influence, Professor Nabila, and they may consult some legal person so that we should register our association. Now, there was another thing, and this is my own idea. I don't know, most of the people, they didn't agree with this at that time, that if we were able to include pediatric surgery in our undergraduate curriculum at national level, from the National Curriculum Authority body, then it will have a great impact on the progress of pediatric surgery in Pakistan. Because one is that pediatric surgery, the awareness about this specialty will increase. When the medical college students are taught a specialty, that specialty is automatically improved. Awareness is improved. Second, that there will be a motivation for our students. They will come to this specialty. At present time, although the situation has improved, but our graduates, they didn't know they were doing their studies in a medical college, and the attached hospital had the specialty, and when they would have been said that you should go to pediatric surgery for house job, they would astonish that what is pediatric surgery, and most of them will run away. So this is important. This will increase the employment opportunities for pediatric surgeon. We will have no brain drain. Now people are leaving this country, our best fellows and brilliant fellows, because they don't have any job. Of course they need a job, and the awareness will improve. And another important thing is our doctors, community doctors, general physicians, they should know the basic of pediatric surgery. They should know that this is hernia, this is hydrocele, this needs urgent surgery, that doesn't need. They should not refer the neonate with umbilical hernia from periphery to center, traveling 150 kilometers, and just for nothing. They come, that increase our workload, and we see and tell them that it doesn't need, and they go back. They should know these things. Now, we should come out of this myth. We ourselves, that pediatric surgery is a super specialty and it is a subspecialty. Why it is a super specialty? It is a specialty like adult surgery. We are giving surgical services to 40% of our population. Our scope of surgeries is more than adult surgery. We are dealing with the congenital anomalies. We have got tumors, we have got trauma. Now pediatric surgery has grown up its own family. We have got the same specialties as in the adult surgeries. So, and we are giving service to children. They are our future. They have a long lifespan. Tomorrow, and if we are producing sick children and illiterate children, then that will become a sick nation. And if you are producing healthy children, educated children, then that will give rise to a very competent nation. So this is an important specialty, and we should promote, we should make awareness among the society, in the decision-making authorities, health authorities, among the civil societies. So for that we should make seminars, we should involve the civil society, we should involve the journalists, so that they should know. Even our health authorities, they don't know about this specialty. And I will just quote you my own example. In 2015, we tried to sanction our post of professor, because in KTH there was only one post of assistant professor, and the rest we sanctioned when we needed. And I took that up to the finance department, and I bypassed the dean. I went through the chief executive, and chief executive was more superior to the dean, because I knew that he will oppose this. He was from general medicine, and but then there was, our dean was changed, another dean came, and he was also from medicine department. And in the final sanctioning, there was a meeting with the Secretary Health, and the Dean opposed the post-op pediatric surgery, and he said that this is a specialty in which there is no need of any professor. This is a very minor specialty. And when I came to know, I went to the Secretary of Finance, and he said, no, this is not an important specialty. We cannot create a post-op professor. So this is the situation. They don't know that pediatric surgery is important. So I think we have set the direction, and we should move forward with this vision that we will enhance our skills. We have to be able to use the technology, the advanced technology. We should convince our professional brothers of general surgery, of pediatric medicine, and that this is now the need of the time. And globally, the situation is in our favor. Now, globally, surgery is an essential part of the essential health services, and it is included in the universal health care. Now, there are global bodies. We have got GICS, Global Initiative for Children's Surgery. They have laid down the whole frame for optimal resources. Where should we have the pediatric surgeon? Every district there should be a pediatric surgeon. So now the global conditions are in our favor, and we should exploit those. We should involve the international players in achieving our goals. We should invite the OPEPs, GICS, WHO, and we should start these awareness programs, and we should start some projects like folic acid enrichment. Why not? If we can use iodized salt, why we cannot enrich our staple food with folic acid? In the whole world it is done. The congenital, those anomalies, either they are fatal or they are causing permanent disability, myelomeningocele and hydrocephalus. So in this way we can improve our exposure to the society, and they can recognize our role. So with this, I think we should move forward, and in the end, I congratulate the new president of APSP and the new cabinet, and pray for their success. We are with you, and at any service we will be available. Thank you very much.
Now I request Professor Ghulam Nabi from Children's Hospital, Quetta, and he's President-elect of APSP.
He's President. He's the President.
Bismillahirrahmanirrahim. Assalamu alaikum. Respected Professor Nasir Salim Sadr, Chairman of the Organizing Committee, Dr. Zeba Asad, outgoing President Professor Anayat Rahman, Director NICH Professor Syed Jamal Raza. It's been a privilege to have all such dignitaries from the fraternity at one platform. This has been such an elegant conference where we can share our experiences and latest knowledge through modern technology during this pandemic. it has become more vital for us to have such kind of gathering more frequently, as this has become the need of our. My deepest felicitation for all the participants, and I am confident that by virtue of their experiences and the presence of our seniors will provide a greater opportunity for our younger lot to embrace themselves with the latest advancement and utilize their skills for the betterment of poor and needy patients. As a president, my vision is to improve APSP academically and financially. I also to introduce pediatric surgery subspecialties and minimally invasive surgeries in country. My special thanks for organizer and all the participants to make this event a great success. May Allah bless you all. Thanks.
Director NICH, Dr. Professor Jamal Raza, to please come here and say a few words about our conference.
Assalamu alaikum. First of all, I would like to congratulate and welcome President NICH and President Ghulam Nabi. Congratulations for your election, and also welcome Dr. Zeba Attar, whom we know for a long time. Also, she has been very much part of NICH. Also, I would like to extend congratulations to Dr. Arshad, I think, who is now the President-elect. And it's a wonderful opportunity to see and greet all the old friends, Noor and Ali and Dr. Shabir I saw somewhere, and Arshad Saab and so many others. So welcome to NICH, and it's really an honor for me to be speaking on this occasion at the Paediatric Surgical Conference. As far as the NICH is concerned, I'm part of the institute now for the last 32 years. और दिलचस्प वाक़या ये है कि जब पहली दफ़ा मैं NICH में दाखिल हुआ था 1988-89, तो जो पहला आदमी मिला था मुझे वो पीडियाट्रिक सर्जन था डॉक्टर फरत। उनके कमरे में मैं गया, वो ओपीडी कर रहे थे और मैंने कहा कि सर वो मैंने पार्ट 1 कर लिया है। तो वो पाशा साहब जैसे कह रहे थे, वो कहने लगे तुमने पार्ट 1 कैसे कर लिया? मैंने कहा सर गलती हो गई, आइंदा नहीं करूँगा। So that was quite interesting, and I have been very lucky to be associated with real legends like Professor Nizam, Sadir Saab, Aziz Saab, and Mohsin Saab, and I would also, of course, I'm not taking the younger people's name here, but they are all very important. And it's been very interesting journey. My NICH has started at a foot soldier and then have been at the top for the last 10 and a half years, and on my way out also. So I've learned a lot from the seniors in pediatric surgery, in their own capacity as persons, as thorough gentlemen, as highly professional people. And I must congratulate all of the pediatric surgeons actually. Because I know that this is not a very lucrative field as far as surgery is concerned. There are many other avenues for being more lucrative. So anybody who does pediatric surgery, I have great appreciation because it's a real work of dedication and not for the sake of money. So really, you all deserve a round of applause for yourself. So, as far as NICH is concerned, जैसे मैंने कहा कि it was very pleasing to hear Dr. Farhat was say that NICH has played a very leading role as far as pediatric surgery is concerned, and I completely agree with that. The names of the people that I have mentioned were giants in pediatric surgery, and they and their discipline and their students and their colleagues have now spread over. And pediatric surgery is now a big field, and over 200 people now doing pediatric surgery. In my own time at NICH as a director, I have tried to improve the pediatric surgical services here. Fortunately, we have had a very good collaboration with the surgical team, apart from the few bhattas from Jamshed, which we had a fair share. But that was very interesting, and I always appreciate the honesty and the dedication of Jamshed, who's here. And he's very much instrumental for this scientific. He's been a very progressive person as far as the scientific sessions and scientific work is concerned, and has always been right at the front, and an asset to NICH. So we've learned quite a lot from these legends, and I've tried to improve pediatric surgery during my own time. We've seen these surgeons grow from a more generalized to a more specialized areas, and we have gone to the laparoscopic surgery, and we have recently added the 4K modular system and the daycare surgeries and all that. So really, it has been a progressive way forward journey as far as my own time and pediatric surgery is concerned. And I hope and pray and honestly think that this will not be the end. This will only be a beginning of a much larger area for pediatric surgery, because we are now envisioning a state-of-art pediatric surgical complex dedicated, which should have all the different modes of pediatric surgery like urology and orthopedics and all the neonatology and all the areas where the pediatric surgeons are now specializing, because that's the way forward. As you have all said, students को भी पढ़ाना चाहिए और doctors को भी पढ़ाना चाहिए, because they all need to know pediatric surgery. The only worry कहना चाहिए शायद कि ठीक लफ्ज़ नहीं है मेरा ख्याल में, लेकिन रिक्वेस्ट कह लें कि pediatric surgeons जैसे grow कर रहे हैं, there's a little bit of distancing between the pediatric surgeons and the pediatricians. I think we need to be more closely associated in our meetings, in our day-to-day conferences, in all our scientific endeavors, so that the pediatrician should also know what the pediatric surgeons are doing, how they are progressing, how do they integrate the best, because after all we are dealing with children together. So I hope and pray that you will all be in close contact with the pediatrician in general in wherever you are working, and have a very close collaboration with them, because that's in the benefit of everybody, and especially the patient. So that's about it, but unfortunately we have recently been hit by COVID, as you all know, and we have lost some very important legends with this disease, and I hope and pray that this will be the end, and we will not lose more valuable and gem person or legends और कोई भी इस दौरान में और इस वबा के दौरान. So I just try and end with a couple of shares from Salim Kausar कि सभी के घर बसे रहें, सबके मकान की खैर हो, आप मेरे दिल दुआ करें, सारे जहां की खैर हो. गुजरे हुए दिनों का हब्स, ये जो पिछला साल गुजरा है, गुजरे हुए दिनों का हब्स फैल रहा है चारसू, अब जो नई हवा चले, साले रमा की खैर हो. So I wish you all the very best in your endeavors. I congratulate everybody for this very well managed scientific conference, and really my kudos to the young team, because they have done a fantastic job. I've heard that a lot of these scientific things are not done by the professional event managers, but they are done by the residents of our surgical team. So really great job for them. So congratulations to everybody. I hope you will have a wonderful scientific session today. Today is already passed, but I've heard there have been very good workshops, and you will have a whole day tomorrow. So best of luck for everybody. Thank you.
Last video message by the Vice Chancellor, United Medical University, Professor Muhammad Tariq Rafi, and before that, a little bio about him. Dr. Mohsina will speak.
Assalamualaikum. Professor Syed Mohammad Tariq Rafi is the founding Vice Chancellor of the Jinnah Sindh Medical University. Being a professor of ENT, he has played a prominent role in promoting ENT education and training in Pakistan and the SARC region. He was the president of the Society of ENT and president of SARC ENT Society and dean of ENT at College of Physicians and Surgeons, Pakistan. Professor Tariq Rafi has also been a member of the Ad hoc Committee of Pakistan Medical and Dental Council and currently heads the Charter Inspection and Evaluation Committee, Government of Sindh. He has also served as a chairman, Central Procurement Committee, Government of Sindh. He is a member of governing boards of the Kidney Center and Chiniot General Hospital. He has more than 60 publications in national and international journals. President of Pakistan awarded him Tamgha Imtiaz for his services to the country in 2019.
It is indeed a matter of great pride for me to be sending this message of mine for the 29th International Conference of the Association of Paediatric Surgeons in Pakistan. I would have loved to be there myself during this conference, but unfortunately because of my being away from Pakistan, it is not possible for me. But I am so happy that I am recording this message and sending it to you people. It is also very heartening to see that during this period of corona pandemic, some of the associations have started reactivating the conferences, medical conferences especially. And the Association of Paediatric Surgeons has taken this bold step, and I congratulate them for this, what they have done. When I was doing my residency, I had the opportunity of working in the Paediatric Surgery Department for 2 months at NICH. And I worked with the legends of their time, like Professor Nizamur Hasan, Professor Sareed, and Professor Abdul Aziz, who was a paediatric surgeon at NICH at that time. And I learned a lot of paediatric surgery as a resident when I was there. Paediatric surgery at that time was taking its, initially the paediatric surgery was started at NICH along with others, some big centers in Pakistan. But over the years, paediatric surgery has definitely improved a lot and has got very strong footings now in Pakistan. And I hope this conference, which is an international conference, will help in improving the learning for our residents. The transfer of technology from outside is something that we require and need these days. And I'm very positive that this conference will be of great help, not only to our residents, but also to our junior consultants in improving the skills and learn from whatever the seniors are going to teach them. NICH has always been in the forefront of pediatric medicine and paediatric surgery, and also the pediatric oncology. And I wish all the best for the organizers, the patron, Dr. Jamaat Azhar, the president, Nasir Sadar, and all of them who have taken this bold step for organizing this conference and who have put so much effort to make this conference a success. I wish that in the next few days that this conference is going on will be a great learning for all those who are here, and I wish a great success for this conference. And I hope that these conferences will go on in the future also. Thank you once again, Pakistan, Hyderabad.
Now next are the two thematic songs that we have just a small video which was sent by Dr. Professor Mohammad Salim, and that's going to play now.
Para मुब्तला कर रखा है। मैं मेडिकल कम्युनिटी के बिहाफ पर आपको यकीन दिलाता हूँ कि इस वबा से लड़ने के लिए हम पूरी अज़्म हिम्मत से अपने फ़राइज़ अंजाम देते रहेंगे और इस कौम के लिए हम किसी भी कुर्बानी से दरेज नहीं करेंगे। अवाम से इल्तमास है कि वह हुकूमती अहकामात पर अमल करे और मसीहाओं को अपनी दुआओं में याद रखे।
कोरोना कोविड-19 इस वक्त सारी दुनिया के लिए एक चैलेंज बन चुका है। इसके इलाज में सबसे अहम इक़दाम इनफरादी हिफाजत है। इनफरादी हिफाजत ही हमारी कौमी हिफाजत की ज़मानत है। हमारे चिल्ड्रन हॉस्पिटल का पूरा अमला, डॉक्टर्स, नर्सेज, पैरामेडिक्स और सप्लाई चेन मैनेजर सब इस मुश्किल घड़ी में कौम के साथ खड़े हैं और यही हमारे हकीकी हीरो हैं। हमारे हौसले बुलंद हैं, हम अस्पतालों में आपकी हिफाजत के लिए हैं और आप हुकूमत पाकिस्तान की बताई हुई तदाबीर पर पूरी तरह अमल करें और बगैर ज़रूरत घरों से ना निकलें। हम इंशाअल्लाह सब मिलकर इस जंग को ज़रूर जीतेंगे।
अच्छा